You peel off your socks at the end of the day, and the elastic has carved a ring around your ankle that takes 10 minutes to fade. Your shoes feel tighter at 7 in the evening than they did at 8 in the morning. You've been chalking it up to tiredness, age, the heat. Here's what's really going on. Swelling in the legs is one of the earliest signals your body sends when something is off with your heart, your veins, your kidneys, or your hormones. And in some cases, not all, but some, it points to deep vein thrombosis, a blood clot inside the leg, which is a medical emergency. By the time this video ends, you'll have a clear framework, 5 major categories of causes, how to tell them apart from simple observation, and what specifically to raise with your doctor. If you want health information explained plainly and without the runaround, subscribe and hit like right now. It genuinely helps more people find this channel. The goal here at Dr. Waterling is 300,000 subscribers, and every single person who subscribes moves us closer. Health content worth saving goes out regularly on my Telegram. Scan the QR code on screen right now to find it. Let's start with the actual biology, because once you grasp the mechanism, the rest falls into place. Your blood vessels are constantly pushing water through your tissues. Some of that water leaks out of the vessels into the spaces between your cells. That's perfectly normal. Your veins and your lymphatic system are meant to collect that fluid and return it to circulation. The lymphatic system is a network of vessels that carries fluid back toward the heart. Picture it as the drainage pipeline running alongside your bloodstream. When either system slows down or gets overwhelmed, fluid builds up in the tissues and you get swelling. Edema, that's the medical term for this kind of swelling, is not a disease on its own. It's a symptom. Your body is telling you the drainage system has a problem. There's a quick self-check you can do right now. Press your thumb firmly into the skin over your shin bone, the hard bone running down the front of your lower leg. Hold it there for about 5 seconds, then lift your thumb. If a visible dent stays behind and slowly fills back in over the next several seconds, that's called pitting edema. It means fluid is sitting in the soft tissue under the skin and not moving freely. You don't need to panic, but you do need to pay attention. Before we get into the 5 big causes, it's worth understanding why some people develop swelling even without a diagnosed condition. Sitting or standing in one position for hours is a major factor. Your calf muscles act as a pump. Every time they contract during walking or movement, they squeeze blood upward through the veins. When you sit at a desk or stand at a counter all day without moving, that pump goes idle. Fluid pools in the lower legs, and by evening, your ankles look like they belong to someone else. Second factor, too much salt. Sodium holds water in the body, which increases the volume of fluid your circulatory system has to manage. Third, chronic stress. Stress hormones, particularly aldosterone and cortisol, tell the kidneys to hold on to sodium and water. Your body shifts into a conservation mode that serves no one. Fourth, regular alcohol and excess caffeine. Both shift vascular tone and fluid balance in ways that can actually trigger a rebound fluid retention once the initial diuretic effect wears off. None of these factors alone is a diagnosis, but any of them creates conditions where a hidden problem in your heart, veins, kidneys, or hormones will show up as visible swelling far sooner than it otherwise might. It's also worth saying clearly, not all leg swelling is equally serious. Mild swelling after an unusually long and active day, which disappears completely overnight, sits at the low end of the concern spectrum. What you do need to take seriously is swelling that keeps coming back. Swelling that's worse in one leg than the other, or swelling paired with shortness of breath, chest discomfort, sudden weakness, or a change in skin color. Any combination like that warrants a same-day call to your doctor. The most dangerous scenario to know about is deep vein thrombosis, DVT. That's when a blood clot forms inside one of the deep veins in your leg, partially or completely blocking blood flow. The affected leg can swell rapidly, feel warm to the touch, and become tender or painful. The skin may look red or take on a bluish tint. What makes DVT so dangerous is that part of the clot can break loose, travel through the bloodstream, and lodge in the pulmonary artery, the vessel supplying your lungs. That's called a pulmonary embolism, and it can be fatal. This is why sudden, one-sided, painful leg swelling is not a wait-and-see situation. It's a go-to-the-emergency room situation. Now let's walk through the 5 most common causes of chronic leg swelling. The first category is cardiovascular problems, starting with high blood pressure, hypertension. Hypertension means your blood pressure stays elevated over months and years, not just on one stressful afternoon. When pressure in the arterial system runs chronically high, the heart has to work harder, the vessel walls gradually change their structure, and pressure inside the venous system rises along with it. That makes it easier for fluid to be pushed out into the tissues. The result? Symmetrical swelling in both legs, mostly in the evening, gradually getting worse over time. When hypertension goes unmanaged long enough, or when there's an underlying structural problem with the heart, it can progress to heart failure. Heart failure doesn't mean the heart stops. It means the heart can no longer pump efficiently enough to keep up with the body's demands. Leg swelling is one of its hallmark signs. Research published in cardiology literature has consistently shown that peripheral edema in heart failure is tied to elevated venous pressure and the kidney's compensatory retention of sodium and water. The longer the underlying condition goes unaddressed, the more pronounced the swelling becomes. This isn't a cosmetic issue. It's a sign of an overloaded pump. Stagnant blood in leg veins also raises the risk of clot formation, especially when other factors are present: prolonged sitting, obesity, smoking, or certain medications. Clinical records document cases where years of ignored leg swelling, developing against a background of both hypertension and venous disease, eventually led to episodes of deep vein thrombosis. That's a compelling reason to get blood pressure checked and not let it drift along without management. If your doctor suspects a cardiac cause, the standard workup includes blood pressure monitoring, an ECG, that stands for electrocardiogram, a recording of the heart's electrical activity, and an echocardiogram, which is an ultrasound of the heart. These are routine, widely available tests. What you can do on your end before that appointment is track your numbers. Write down what your blood pressure readings look like at home, note what time of day the swelling shows up, and record whether it responds to lying down. Walking in with that kind of specific information makes for a far more productive visit. The second major cause is varicose veins and chronic venous insufficiency. Varicose veins develop when the walls of the veins and the tiny one-way valves inside them get damaged and stretched. Those valves are supposed to keep blood from sliding back down toward your feet, but when they fail, blood pools in the lower legs. From the outside, you see twisted, bulging, rope-like veins under the skin, or a finer spider vein pattern. By evening, the legs feel heavy. There may be a dull ache or a sense of pressure, nighttime cramping, and itching along the affected veins. Research on chronic venous insufficiency has shown that prolonged inactivity disrupts the calf muscle pump, raises venous pressure, and accelerates valve damage. Add smoking or hormonal shifts and the process speeds up further. A phlebotomist, that's a physician who specializes in vein disorders, has tools including venous Doppler ultrasound, compression therapy, and, where needed, minimally invasive procedures. But it's worth knowing, compression stockings, movement breaks, and weight management are frontline interventions that genuinely make a difference, and none of them requires a prescription. Left unmanaged, chronic venous insufficiency can progress to venous ulcers, patches of skin on the lower leg that break down and fail to heal because the tissue isn't getting adequate circulation. Studies on venous ulcer management have consistently identified edema control and improved venous return as central to healing. That's why the approach to varicose veins reaches far beyond cosmetics. If you're noticing chronic heaviness and swelling in your legs, and the skin around your ankles looks thickened, discolored, or itchy, that's worth taking up with a vascular specialist sooner rather than later. Here's a pattern that turns up regularly in primary care. A woman in her mid-50s notices that her legs swell by 5 in the evening, and she's been chalking it up to a long week on her feet at work. Her name was Carol, and what eventually brought her in was a small patch of discolored skin just above her left ankle. Venous Doppler showed moderate valve insufficiency in both legs. Early stage varicose disease, caught before ulceration began. A structured compression and movement program made a real difference within weeks. The point is, the the window for easy intervention doesn't stay open forever. The third category is hormonal and endocrine disruption. Hormones regulate vascular tone, the balance of sodium and water in the body, and the integrity of blood vessel walls. When hormone levels shift significantly, the body's fluid management shifts with them. The clearest example is perimenopause and menopause. As estrogen levels decline, cardiovascular risk rises, blood vessels behave differently, and many women find their legs swell more predictably in the evenings than they ever did before. Exercise tolerance shifts too. Long-term smoking belongs in this category as well, because nicotine and combustion byproducts damage the endothelium, the thin cellular lining inside blood vessels. That damage impairs microcirculation, the network of tiny vessels feeding the tissues, and accelerates atherosclerosis in peripheral arteries. The tissues of the lower legs become gradually underperfused, meaning they receive less oxygen and fewer nutrients than they need, and chronic swelling and pain on exertion can follow. Diabetes deserves its own attention here. When blood glucose stays elevated for years, it damages both small blood vessels and peripheral nerves throughout the body. This leads to diabetic neuropathy, nerve damage, and diabetic angiopathy, damage to small blood vessels. Together, these processes can produce diabetic foot syndrome, wounds and ulcers on the feet that heal poorly, carry high risk of infection, and in severe cases lead to amputation. Studies on diabetic complications have consistently shown that diabetic foot ranks among the most common serious outcomes of long-term, poorly controlled diabetes, driven by the combination of nerve damage and impaired arterial flow. If you have any reason to suspect hormonal or metabolic issues, weight gain, a family history of diabetes, a fasting glucose reading that keeps creeping up, that's a conversation worth having with an endocrinologist. A fasting blood sugar consistently above the normal range is a signal worth investigating in full context, not in isolation. The fourth cause is kidney disease. Your kidneys act as a filter and fluid regulator. They control how much water and salt stay in your body and how much gets excreted. When kidney function is compromised from any number of causes, two things often happen. First, the kidneys lose the ability to retain protein, so albumin, the main protein in your blood, starts leaking into the urine. With less albumin in the bloodstream, the pressure that keeps fluid inside vessels drops, and fluid leaks into tissues more easily. Second, the kidneys hold on to sodium and water as a compensatory response, making the problem worse. The typical pattern of kidney-related edema is soft, generalized swelling, and one of its distinctive features is morning puffiness around the eyes and face, in addition to the legs. Clinical reviews consistently name kidney disease alongside heart and liver problems as one of the main systemic causes of bilateral lower limb edema. If your leg swelling comes along with changes in how your urine looks, rising blood pressure, persistent fatigue, or reduced appetite, a basic metabolic workup makes sense. That means a urinalysis and a blood panel that includes kidney function markers. This isn't about alarming yourself. It's about having a conversation with your doctor based on actual data rather than guesswork. The fifth cause is the one most people never consider: mechanical problems in the lumbar spine and pelvis. The mechanism here is less obvious than the heart or kidneys, so it often gets missed for years. Major blood vessels and lymphatic collectors run through the lower back and pelvic region, channeling fluid return from both legs upward toward the central circulation. When there's chronic muscle spasm in the lumbar area, joint restrictions in the lower spine, or structural imbalances in the pelvis, these vessels can end up partially compressed. The result is reduced venous and lymphatic drainage from the lower limbs, and swelling that doesn't respond cleanly to treatment aimed at the legs themselves. Publications on chronic venous disease have noted that mechanical factors including postural dysfunction and pelvic lumbar restrictions can worsen venous stasis. Research into osteopathic and manual approaches to lymphatic drainage has shown measurable reductions in edema in select patient populations, though the evidence base is still developing and more large-scale trials are needed. The principle is straightforward. When you reduce mechanical tension in the areas where drainage vessels pass, the return of fluid from the legs becomes more efficient. A documented pattern in clinical practice looks like this. Someone has a desk job, chronic low back fatigue by the afternoon, and persistent leg swelling that no one can explain. A phlebotomist finds no significant varicose disease. Cardiac workup is unremarkable. But when a manual medicine specialist evaluates lumbar and pelvic mechanics and finds multiple areas of restricted movement, a targeted rehabilitation program brings noticeable improvement in the swelling. Not because the veins were treated, but because the outflow path was cleared. The takeaway: if your swelling has been thoroughly worked up for the common causes and still isn't explained, lumbar pelvic mechanics are worth adding to the conversation. When a clinician sees a patient with leg swelling, the first questions are very specific. Is the swelling in one leg or both? Is it soft and pitting or firm and resistant? Is it worse in the morning or the evening? Is there pain, warmth, or skin color change? Then comes the history: blood pressure, chronic conditions, medications, activity level, smoking status. One important point about medications: several common drug classes can cause or worsen leg edema as a side effect. Calcium channel blockers used for blood pressure and heart conditions are among the most common culprits. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, can promote fluid retention too. Certain diabetes medications have also been linked to edema. If your swelling appeared or worsened after a medication change, that specific detail is worth flagging at your next appointment. On the practical side, here's what the evidence supports as genuinely useful, not as self-treatment, but as approaches worth discussing with your healthcare provider. Movement is foundational. Research on venous disease and thrombosis prevention consistently supports calf muscle activation as a key factor in reducing venous pooling and improving return flow. Even breaking up prolonged sitting with 2-minute walks every 30 minutes can produce measurable benefit. Cutting back on sodium takes pressure off the circulatory system and reduces fluid retention. Not a replacement for treatment, but a meaningful supportive step. Managing body weight reduces pressure on leg veins and the pelvic vessels. Quitting smoking improves vascular function at the microcirculatory level, which is where leg tissue health is determined day to day. As adjunct strategies, doctors sometimes bring in lymphatic drainage massage, positional drainage, which means lying down and raising your legs above heart level for short periods, and targeted exercises to ease lumbar tension. These are supportive tools, not cures, and one hard rule: before using any massage or manual technique on swollen legs, deep vein thrombosis needs to be ruled out. Mobilizing a blood clot is dangerous. Risk increases noticeably after age 45. Heart, vascular, hormonal, and metabolic problems all become more prevalent as the years stack up. Drop a comment and tell me how old you are. It genuinely helps me understand which age group this topic is hitting hardest right now, and I can plan the next videos around where they'll do the most good. Here's what to take away from this. Leg swelling is always worth taking seriously as a signal from your body. The 5 major categories are cardiovascular problems, including hypertension and heart failure, varicose veins and chronic venous insufficiency, hormonal and endocrine disruption, including diabetes, kidney disease, and mechanical dysfunction in the lumbar spine and pelvis. Each category has its own pattern, and your job isn't to diagnose yourself, it's to notice the pattern and bring specific, useful information to your doctor. When did it start? Which legs? Morning or evening? What makes it worse? What makes it better? That's the conversation that moves things forward. If this gave you something genuinely useful, subscribe and leave a like. That's what helps this channel grow. We're building toward 300,000 subscribers at Dr. Waterling, and every person who sticks around brings us closer. Scan the QR code on screen to follow along on my Telegram. That's where the practical checklists and follow-up posts go out. Everything in this video is for educational purposes. Use it to have a better informed conversation with your own doctor, not to replace that conversation.